Hi guys, thanks so much for joining me on this episode of The Health Curve. Today we're going to be talking about fatty liver and why it's not just about the liver, it's at the center of today's biggest killers and chronic diseases, things you've all heard of: heart disease, obesity, diabetes, shortened health span and lifespan, etc. We're fortunate to be joined by Dr. Mazen Noureddin, who is a world leader in liver and metabolic health. And we're going to talk about what fatty liver is, how it works, and what you need to know about it. Let's dig in. Mazen, thank you so much for joining me. It's great to have you here.
Thanks, Jason. It's a pleasure to be here today.
Okay, let's talk about fatty liver. First of all, why is the liver important in metabolic health? Like, what does it do?
Actually, as a hepatologist, I think liver is one of the most important organs in the body, if not the most important, as your liver sits on the right side of the body, just a little bit underneath the rib cage behind it, and in charge of making a lot of things. Like it makes actually sugar, it metabolizes fat, it metabolizes toxins in particular. A lot of medications that come through the body come through the liver and gets filtered and just expelled that way. In addition, a lot of like the food we eat fat gets stored in the liver or processed through the liver, and a lot of really, really good things. And a lot of people know, like out there in the public, that the liver is the only organ that like self-regenerates itself. Like for instance, when we cut the liver, and sometimes we do live donor liver transplant, we put that piece of the liver from someone else, and within 8 weeks, you'll see like almost the entire liver back in your body. And same thing, if you cut it, it will regenerate itself. So it's a very vital, important organ in the body. And its damage can lead to really quite a bit of illness.
Okay, so we often hear about things like heart disease, diabetes, obesity, being overweight. Even brain health is talked about a lot more these days amongst the public. But why should people care about the liver? Like, what kind of role, beyond being let's say, the metabolic factory of the body, what role does it play in cardiometabolic disease and longevity more broadly?
Yeah, and I think this is what you meant by fatty liver, Jason. And the liver is supposed not to have a lot of livers within the cells. So what happens is the liver makes fat and then sends it as energy or metabolize it. And the excess fat goes into the liver, and the liver also metabolizes it in a way or another. Part of it goes to what's called mitochondria, which burns the fat. But at a certain point, when that process becomes excessive, too much food, too much calories, a lot of people started gaining weight. We have the concept of insulin resistant, that your insulin handling in the body is not the same. What happens is, sadly, like that fat started sitting in the liver. And it changes color, becomes more yellow because of the fat. And over time, that buildup does the same thing like other diseases. It starts causing damage. With this epidemic of obesity as well as type 2 diabetes, the liver can affect it too by kind of having that fat getting stuck within it and not being able to get rid of it. Over time, and this is very common, Jason, it's almost 1/3 of the country they have fat in the liver, which luckily it's not the problem most of the time. Nevertheless, many people progress when the body say, well, this is fat, it's not normal, react to it. And you get started to have inflammation in the liver. And inflammation in the liver trying to react to this excessive fat. And eventually you start getting scars, fibrosis. Over time, scars lead to cirrhosis of the liver. And I get a lot of patients in my clinic, in my office, will say, doctor, I don't really drink. Where's that fat coming from? Or where's the liver damage coming from? And it's unfortunately that type 2 diabetes, obesity, excessive fat intake, that the liver tried its best. And then when it's fed up, it cannot do it anymore, start getting sick and ill over time. And unfortunately, eventually lead to cirrhosis. So it is actually the most leading cause of cirrhosis and liver transplant in women nowadays. While in men, it's alcohol, followed by fatty liver from non-alcohol causes. So it's a big deal.
And if the liver gets damaged over time in this way, what are the implications for the person's overall health?
Yeah, so that's another problem, Jason. Eventually, you will see people walking in the street have fat in their liver, which is not normal. Excessive fat is not normal. More than 5% is not normal in the cell. A lot of times, nothing happens. It doesn't progress. But also, some people starting progressing without, I shouldn't say not having symptoms, without noticing symptoms. They get tired. They get some right upper quadrant pain, which is the right side of the liver, which is not much. So a lot of people say, I don't have issues. I don't have problems. But meanwhile, there's something cooking underneath. Is the fat going to the liver? And then over time, inflammation, and then the scarring. Still, the symptoms are not noticeable unless if you look for the disease. And all of a sudden, when it's really late, you start to have complications of cirrhosis. Abdomen gets swollen with fluid that we have to take it out, drain it, or give water pills. People get confused because the liver is completely scarred and it's not doing its job by clearing these toxins, or even sometimes vomiting blood from what we call varices, which is swollen veins in the food pipe because the liver is pushing back on this now because the liver is stiffer, push back on the veins in the food pipe. So that's how usually it presents itself. And unfortunately, we see in our liver clinics.
So the message to people here is that the liver is a critical organ that performs many vital functions for the body. It takes a bit of a beating, it can recover, but over time, at some point, the liver starts saying no more. And that can lead to a whole host of other disease consequences, let's call it that. And we have a name for this progression of fatty liver disease, right? We have names. So there's MAFLD, there's MASH. Can you tell us a little bit more about what these things mean?
Yeah, so and the terminology changed over time, and I'm not going to go over all of them in details, but MASLD is a short term for metabolic dysfunction associated steatotic liver disease. It's a long name, which is all it translates into the fatty liver. But what it's telling me, steatosis is fat, metabolic is the metabolic syndrome. So due to metabolic syndrome, we started getting this kind of effect of fat accumulation. Your dysfunction, your metabolism is not working perfectly, leads to steatosis in the liver and eventually what's called MASLD. Over time, I told you the body reacts and we get inflammation. And this is what we call it, the metabolic associated steatohepatitis, which is fat plus inflammation in the liver. Steato, fat, hepatitis, inflammation. That doesn't mean there's a virus or like this contagious. It's just the inflammation on the liver. So MASH, and then eventually MASH with fibrosis, MASH with scarring. And that is stages. It's like moderate and advanced. And eventually the cirrhosis due to MASLD and MASH. So those are, you want to think about it, MASLD at the beginning of the road, and then MASH comes and eventually scars all the way to cirrhosis.
We'll get back to this conversation in just a moment. But if you're finding this episode helpful, here's a quick ask. Take a second to follow or subscribe to the Health Curve podcast, wherever you're listening. And if someone else in your life would benefit from this episode or any of the others you've heard, please send it their way. All right, let's get back to it. So if we're going to talk about where does fatty liver disease fit into the metabolic disease puzzle? Because there are strong associations with heart disease, type 2 diabetes, chronic kidney disease, obesity, etc. Can you tell us a bit about how that whole picture works and the role of the liver in that?
I call this disease as a cousin of the others when my patients come talk to me. They're cousins. They hang out with each other. They grow up with each other, and eventually can get a big problem. Usually affect all these cousins that they grew up with each other, or problem like in the same neighborhood. And as you said, like MASLD and MASH can end up with a heart disease, heart attack, not because they're all under the same umbrella and the inflammation goes across and all the reactions goes across, or can go by itself, drive everyone else down, which is if you get cirrhosis, multiple organs will shut down over time. So there's this interconnection between these multiple organs that unfortunately fall end of the day under the same umbrella, type 2 diabetes, obesity, and insulin resistant problems, that they all hang out with each other. They have same issues, same problems, and one of them will get the rest in trouble. And liver can contribute to that if it has fat inflammation in it.
For some reasons, it was easier for me not growing up with cousins, but there you go. So, okay, that's clear. How do people normally find out that they have fatty liver disease? And this is becoming increasingly relevant to more and more people. It's estimated, 100 million people in the US may have at least early stage fatty liver disease now, and that millions will progress to advanced liver disease. And that would be associated with all the problems we've just discussed. How does it come up?
Good question. I would say I'll answer it into two answers. How is it usually, and how should it be? How's it usually? Back in the days, a lot of patients were gone unnoticed. Oh, there's fat in your liver. There's a little bit elevated liver enzymes. Oh, your enzymes are normal. And then they are on my footstep door with cirrhosis, with its complication, with the they are going to the hospital because they have vomiting blood. So that's a sad presentation. Nowadays, more people are being alerted to it as a problem, primary care doctors. And they're saying, well, fatty liver, maybe you want to check with your hepatologist. Unfortunately, there's still some that they are not as quite aware, including primary care, because we didn't have treatments before, now we do. We didn't know much about the disease before, now we do. And it's the way it's supposed to present itself and what needs to be done about it today. If you do have, and I want to send this message through your podcast, Jason, if you do have type 2 diabetes or 2 metabolic risk factor, what does that mean? High blood pressure and cholesterol problems. If you have one of those, or your liver enzymes elevated, do ask your primary care if you have fatty liver or not. And there are simple tests that can be done. And usually they sit in your blood tests. And if you just do calculation, there's that test called FIB4. If we do that FIB4 test, we will know if the patient is in trouble in terms of the liver or not. If you see fatty liver in imaging, ask the doctor, do I have any scarring? How can you make sure I don't have scarring? So that's the way it's supposed to present. Now, luckily, we're seeing more cases that they're coming to us because the doctors now are more aware. But we still see late cases, which should not be the case anymore.
And the good news is, if it's caught early, it can be reversed, right? So before we go on to some of the medications that are available, like how should people address this if they find out, okay, I've got fatty liver disease, what do I do now?
Yeah, so I am even an advocate of patients doing it themselves. You are your best advocate, right? Jason, you don't have to be a doctor, but a little bit of knowledge is very important. And the internet is full of stories, full of good things and bad things, and correct things and incorrect things. So the first thing is, if you see a fatty liver, this is what I would love people to do. Look at their liver enzymes and look at Google something called FIB4, FIB-4. And there's a formula calculator. Ask for a couple of liver enzymes, ask how old you are, and ask for another blood test called platelet. They usually sit in your chart: ALT, AST, platelet, and age. I'm going to repeat them: age, ALT, AST, and platelet. They're sitting in your chart. I mean, your age, you know, it's age, your age. So you do the calculation, and the calculation will spit out the answer for you. We'll say, Jason, if you are more than 1.3, you need a liver doctor. That's what people need to know. And the people that I really think every single diabetic person on earth should know what that score that they have, so they can take care of it early enough. And taking care of early enough, sometimes you don't even need medicine if you don't have a scar. It could be losing some weight. It could be exercising, improving your diet habits. And sure, like, yeah, I hear this most of the time. Everyone is telling me, well, if they tell you like you have a heart problem and you have heart blockage and you need to lose weight at cholesterol, you will do that. And if you find it in the liver and they tell you might get cirrhosis if you don't get better, you want to calculate that rather than coming really late.
Okay. And so the first port of call, once this is done, is for people to start with lifestyle, right? So things like weight loss and getting fitter. So that would be first, right?
Yes.
So the usual things: exercise, improving your diet, etc. There are other episodes on that where we go into a lot of detail. But then at that stage, what are the therapies that are generally available for this? And what would you advise patients to do if they're concerned?
And let me also, because I get a lot of questions about the diet, and there are a lot of books and good things and funky things, I would say, out there in different forms of internet, even podcasts. Should I eat this and that? And I'm like, I never heard of that, that we did research on it. But organic solutions are always great solutions because it's the human nature. So what we recommend in terms of diet, the most literature we have is on Mediterranean diet. Drinking coffee, cardiologists don't like it sometimes, dentists don't like it. It blackens the teeth. Cardiologists don't like it because it might cause heart problems, heartburns. But also, on the other hand, for liver, it's actually beneficial to have coffee. So we do like coffee. If you like coffee, drink coffee. The Mediterranean diet, as it sounds, but also there are now more recent evidence. For instance, the low carb is one of the most beneficial ones. There are people doing diet intermittent fasting. I tell my patients the low carb, bread, pasta, dessert. Some people don't consider them carbs. It's actually carbs. Ice cream is a carbs. So, and cutting out the bread and pasta and all this will extremely be helpful, these patients. Now, if they come to me at a stage that they started getting scarred, especially significant scar, I do still recommend lifestyle intervention, weight loss and exercise. On the other hand, also, there are some medication now targeting the liver. And as of today, we do have 2 FDA-approved medication. One called is resmetirom, which is a pill, and the other one is semaglutide, which everyone heard about out there. It's a weight loss medication. It's also commercially known as the Wegovy. So those are both two FDA-approved medications that they can help you reverse fatty liver, reverse inflammation, and scarring to a certain point. There aren't many other medications in the pipeline that I think they're gonna hopefully eventually lead to cure of this disease and reversing it, including, I'm hoping, those that even have cirrhosis, especially early cirrhosis, but we're not there yet.
Excellent. In the last bit of this episode, let's just quickly do some mythbusters. I'm sure you hear a lot of myths coming into your door in your clinic. Can you tell us what are some of the top myths that you hear about fatty liver and the things we've discussed, and what is really true?
A lot of things. So fatty liver happens in only people that they drink. Incorrect. If you don't drink heavy alcohol, if you're overweight and have type 2 diabetes, it is likely that you have fatty liver. 60% of type 2 diabetics have fatty liver. Another thing, fatty liver happen only in overweight people. Incorrect. We have a phenomenon called lean MASL or lean fatty liver. A lot of Asian population and Indian population, they do have that. You see like this small little bit belly and insulin resistant, and that fatty liver inflammation and scarring are irreversible. That is incorrect. It is reversible if you catch it early enough at a certain point. And I don't want to go into the funky diets and stuff like this. I heard about vinegar, I heard about this and that. So be careful of what is out there in the internet. Supplements. I am a person who has done research on organic and natural things as supplements. I would say very limited one and very specific one could be helpful. And we still need more research on them. So that's why I'm not going to spell them out yet. But many can be harmful. So be careful not to take anything that could be harmful. And I know like some people believe that doctors don't believe in supplements and organic stuff. We actually do. It's just like the right research, the right formula. A lot of supplements out there are mixed with harmful things. So be careful with that as well.
Excellent. Thank you so much for joining me for this episode on fatty liver, Dr. Noureddin, and hope to have you back soon.
Jason, this is a fantastic program. I was privileged to be here, and I look forward to be on your episode again and for people to hear about fatty liver and get educated.